Turn you to the side, your cough. And sorry about that. Then turn the. Okay, hang on a minute.
And there's Dr. Singh.
Hey.
Dr. Singh, thank you so much for agreeing to be a part of our video.
No problem.
And the idea is you get to see the doctor's doctor in this video. Dr. Joseph Cerny is the doctor in the same town, and he's who I choose for my health care.
Excellent.
So,
how are you guys today?
Good. This is our first visit, and he's going to get to know my initial evaluation of my past medical history, and we'll get to know each other on a different level.
That's right. So are you guys going to the Placer football game this Friday? Or?
It's not a home game this week, is it?
Is it? Yeah, no, I don't know. I heard they were playing down in Elk Grove or something.
Yeah. No, but we did go to the play last week.
Yeah, good.
Yeah.
Excellent. So, did I hear you injured your back or something? Or?
I had had some back pain. It's resolved now.
Okay.
Did some physical therapy at American River.
Okay, excellent.
And thankfully it's gone.
Good deal.
Yeah, there was a time there.
All right.
Well, yeah, you saw me kind of walking around funny, I think.
Yeah, that's right. So, your birthday's 11/29, right?
That's correct.
Okay, all right, just making sure. All right, just make sure we have the right Dr. Vaughan. All right, so a couple quick questions. So Ann did a little bit of the intake history, and I kind of come behind her and just ask a few of the questions. But so other than a vasectomy, have you had any other surgeries, tonsils,
Circumcision.
Knee other than that?
No.
Nope.
A couple molars removed.
Okay, all right. Any ear tubes or anything like that? Okay. And in your family, I saw the intake that she put down. Anybody from grandparents on down have cancer?
Skin cancer, basal cells, squamous cells.
Okay, who said that?
My father.
Okay.
Mother with breast cancer.
Oh, that's right. Mother had breast cancer. Thank
Okay.
you for remembering.
Sure.
Gotcha. Let's add that there.
Good job.
And was she young when she had it, or?
No, she was in her 70s?
60s.
Late 60s.
60s? Okay. And so?
70s. She was in her 70s.
So there's a little bit of dementia in your family, I understand.
Yeah.
Gotcha.
Yeah.
And so are you diet pretty good in vegetables and antioxidants and?
The G-bombs.
Yeah.
Yeah.
Good. So I'm gonna keep
Greens,
that up.
beans.
And you might even want to. I don't know. Do you take aspirin?
No.
So that might be something you might want to consider. I mean, normally don't recommend it to everybody, but with the family history, 2 people with dementia might be something to consider.
Okay.
And then let me see here. Then she mentioned something about PPD positive
PPD positive in medical school.
in medical school.
Treated with INH.
Oh, okay.
Last chest x-ray should be on record at, or at least a reading of it at Auburn Imaging.
Gotcha. Everything's been okay, no major chronic cough or anything like
No.
that? Okay.
No.
All right. Anybody in your family with any gastrointestinal disorder? I mean, other than cirrhosis, maternal grandfather, any gastrointestinal type things, or
No.
any thyroid disease, any
No.
let's see. So I see the heart disease and hypertension in the family. Any, have you ever had a problem with hypertension, high blood pressure?
No.
Okay. Well, that looks good. And you don't smoke, don't drink, right?
Correct.
And I'm assuming no drug use. So okay. And
Sexual history, lifetime monogamy.
very good. That's something to be said about that. That's good. So let's see. And so 5 kids?
4.
4 kids. That's right. Okay. And Okay. Well, there's a lot of questions I'm going to ask, but before I do you have any particular medical worries or concerns?
I don't think so.
Okay. Do you exercise regularly?
Mm-hmm.
Okay, good. How often do you exercise?
It's a minimum of 3 days weekly,
Okay,
but sometimes as many as 5, running
good.
home from work.
good. Excellent. So
Sometimes it's more walking than running, but definitely 5 to 10 miles a week.
good. Oh, excellent. Yeah, so as you know, we recommend minimum 3 days a week, an hour of vigorous exercise, or more often a week, 4 days a week, at least a half an hour of vigorous exercise. And sunscreen?
Getting better about it. Yes, I did have some actinic keratoses burned off by Dr. Gawain
Precancerous stuff.
and in the classroom.
And did you scream?
I thought it was going to be worse than it was.
Oh, okay.
I'm surprised it wasn't worse. Because I keep hitting my fingers when I do them on patients.
That's good. And you haven't had to do any
Wasn't it?
pimple popping lately, right?
Not on myself.
Gotcha. Okay. Any concerns or changes with hearing or vision?
I do wear contacts for vision.
Okay.
Go to Auburn Eye Care regularly for that.
Okay.
Hearing, listen to too much loud music and try to be better about not doing that. But
Okay. Do you fire weapons or around?
no, I mean very, very rarely. Like last time I did was with Nat Tucker.
Okay, gotcha. Any, let's see, any chest pain, shortness of breath, palpitations,
No.
dizziness?
The occasional, like after you do a workout and you sit
Yeah.
for a while and then you get up, that usually.
But not like,
No.
other than that, never, don't pass out or
No.
anything. Any black stool, blood in your stool, blood in your urine, skin changes, new or unusual moles, getting up to go to the bathroom much at night,
Maybe once if I drink
Okay.
too late, maybe.
alright. Major headaches.
I have experienced what I would consider to be migraine on
Mhm.
a handful of occasions,
Okay.
usually with a definite trigger, like strobing light through the trees as you're driving and
Okay.
pushing
Any?
at sundown or something like that.
How often does that happen? I mean, like.
Not even annually.
Okay. Do you have family history of that migraines?
Yeah, my father.
Father. Okay. And do you get nauseated when you get a migraine?
Yep, that's happened again just a handful of times in my life.
And do you get any visual?
One time I had homonymous hemianopsia. The left central field of vision was absent.
Gotcha.
Resolved within just 15 minutes. Thankfully, that one had no pain associated with it. It was just the visual and then gone.
Gotcha.
And worked with Blodgett and Orcott on that one.
Excellent. Okay, good. And do you when that happens, do you take medication, or do you want to have some
Well,
medicine on hand, or?
Yeah, I've been successful with anti-inflammatories, Tylenol, and caffeine.
Okay. And will that usually work within an hour? Or?
Not once it started. No,
Okay.
it's a miserable night.
Do you want
That's
to
all I got.
have prescription medication around in case you?
It's so rare.
That might expire.
I think I'd hold off on
Okay.
it and just do what we have up to this point.
We used to get samples of all that stuff, and I don't think we've had a single rep come by for,
There's no new ones.
yeah, exactly, 3 or 4 years.
You can do anything.
Alright. That's usually when we tell little kids that Mickey Mouse is hiding in your
Yeah,
ears or
right.
something.
So there might be some scarring from years ago.
You have your, go ahead and lift up your tongue for a second. Okay. And just gonna Check your lymph nodes. It's called submandibular lymph nodes, cervical. Check your thyroid. The best way to check the thyroid is kind of behind. And go ahead and swallow. Okay. That looks good. Yeah. It's okay if I turn out the lights?
Yeah.
Okay. Just gonna just check your eyes for just a minute here. And if you could look
Over
yes,
there?
toward the camera, I guess, or toward somewhere
The
on
wall
that.
there.
And again, kind of toward that. And take a. Actually heard a carotid bruise on a patient today.
You
For the
did?
first time like in a
Oh my
year, 2
goodness.
years or something.
I haven't heard that.
And they had an anaphylactic reaction.
Oh my goodness.
Walk in on last. I can't remember what day of the week, but and I was by myself at lunch.
Oh my goodness.
And I almost called 911.
Yeah. Grab the EpiPen.
Grabbed the EpiPen and her oxygen went from 89 to like 97, like in 2 or 3 minutes.
Oh man.
And but that's only happened.
We're not set up for that.
Yeah, this happened like I think I've had 2 since I've been in this office the last 12 years. Have you go ahead and open your mouth and take a deep breath. And deep breath. Okay. And deep breath again. And good. And go ahead and lie back for a second. Good. A second here.
Sorry, honey. Sometimes I've wondered.
You have a little deficit here, but it's not like
Yeah.
it's not like a full blown umbilical hernia, but
Nothing's coming out.
check your lymph nodes. Excuse me. Okay, lymph nodes. Okay, and go ahead and lie back for a second here, and go ahead and kind of lie down for just a minute. Okay, and so with your back, because it's not bothering you currently, I'm just gonna lift your leg up and just. When it was flaring up, did you have anything going down your legs? Any numbness or tingling or loss of control of your bowel or bladder function? Or anything
None
like
of
that?
those, no.
Other than stretching your hamstring, is that
I
doing
feel
anything
that.
else to you?
No,
Okay.
just tight hamstrings.
Okay. And is that doing anything to you?
Yeah.
Okay. All right. I'm gonna have a sit up for a second. I'm gonna just a minute. Just the reflexes. Okay. And I'm just gonna check your skin. Do you have any concerns about any moles or any?
Wherever the dark ones are,
You can probably see them. I think there's one over here somewhere, but they've not changed that we know of.
The little red dots are called cherry hemangiomas. Those are benign. Those little balls of capillaries that are
Finally old enough and getting those, yes.
autosomal dominant. You owe it to one of your parents.
Yeah.
And
And solar lentigos on the torso of the hands, because I haven't been good about protecting my skin.
okay. And then I'm just gonna kind of bend forward just a second. Sorry.
Yeah, since losing my hair, I have been pretty good about keeping sun off of it, which,
Okay, you can go ahead and lift your head up for one second. Sorry.
oh yeah, you got my cyst over there.
Yes, sir.
Yeah, it ruptured once.
Yeah, I don't see anything that looks like concern. Okay, and if you want, I could check with your legs. It's up to you.
Check my leg. Oh, no, skin, no.
Yeah, you're good there.
Hernia check would be the only thing I wanted.
Okay, so let's do that.
Yeah.
And then in terms of doing a rectal, I mean, normally we at age 50 now.
I was gonna say, do you do before age 50?
No, I mean, I've always traditionally done it, but now the new guidelines are all kind of heading away from that. So,
Well,
yeah.
years, I guess. So.
All right.
All right, so. Yeah. She's framing it high for this part.
Yes.
Excuse me. And turn your head aside and cough. Hang on a second. And sorry about that. And turn the. Okay, hang on a minute. Sorry, just about done. Okay, you're fine. Okay.
Just fine.
You're good. Do you want me to say stellar? You're good. Alright.
Okay, anything else? Any other exam?
Yeah, no, you can go ahead and change and I'll go over some stuff with you. Yeah.
Okay. Put my running shirt back on. Won't be seeing patients, I guess we'll put the tie on.
Yeah. So, a couple things. Have you had your flu shot this year?
Yes, yes.
Okay, so you're good. So yeah, I recommend getting those every year, and that's for everybody.
Yeah, that is.
So, pretty much. And also, just make sure we already talked about exercise, and your height to weight ratio looks good, so that's fine. And again, sunscreen minimum 30 SPF or higher, preferably 50. Wear a hat if you're gonna be out in the sun for a while. And in terms of food, we want to make sure that, when we grew up, when we were kids, we had the 4 food groups, and now everything's changed. And now they're
Yeah.
saying that a half a plate should be all vegetables and
Yeah.
fruits, and then the other
Yeah.
half can be low fat proteins.
Yeah.
And ideally you want to try to make half of your meals vegetarian only, and then the rest high fiber, low animal fat. And then with your family history of dementia, like we talked about, high diet antioxidants, blueberries, blackberries, raspberries. Exception would be, do you have any history of kidney stones?
Nope.
Okay. So some people with calcium oxalate stones
Yeah.
can't take as much of that, but there even that Indian spice turmeric is a good antioxidant.
Okay.
And then consider maybe taking a baby aspirin a day, and continue exercising regularly. And let's see, have you had blood work done in a while, or?
No, I just go with whatever the recommendations are from the NIH,
Yeah.
unless you really felt compelled to check anything else.
And we're I mean, usually it's cholesterol check for men. I believe it's isn't it 35? The
35.
first one. Yeah.
35 unless there's
Yeah.
risk factors. So
Yeah.
I guess I'd be due for that.
Okay. So we can.
Ask a lipid panel.
So just fast, minimum 10 hours. And then you can go to any one of these labs listed here.
Yeah, I'll probably go to the one next door to my office.
Yep.
Oh yeah, the education street. Okay.
Yep.
Yeah.
Very good. But otherwise, I mean, your lung sounds good, your heart sounds good. I don't see any premature cataracts. Your ears look good. There's no hardly any wax at all in there. And skin-wise, I didn't see any concerns. I didn't see any unusual moles or anything like that. I really didn't see any major concerns. So just continue what you're doing. And any questions or?
Oh, I do want to get set up for my health online.
Okay. Yeah. Oh, absolutely. Yeah. So I'll give you we'll print out a paper with the code on it and everything.
Okay.
So, yeah. We'll
Good.
That, so very
Yeah,
good.
I'd like to do that, and I'll get the labs, and I guess we'll be set for a year.
Yeah. Very good. All right. Well, good to see you.
Thank you, Jeff.
All right. Take care.
Thanks for joining us for my visit to my doctor. Now you know who the doctor goes to for a doctor. We thank some people for helping us make this possible. Some of our patrons, specifically Lindsay Graff, BooBoo Kitty, and Petra Rosenberg. Thank you, ladies, as always, for making this possible. Until next time, Dr. Cerny and Dr. Mark Vaughan telling you to stay in good health.